The problem statement is clear. We're going to face a situation where we have many more old people requiring much more care, and we're seeing a decrease in number of people providing that care. So to sustain a level of quality of care, it's unavoidable that we'll need information technologies to keep the productivity also up of the providers of that care. We think that ICT is not only about cost saving, it's also about providing better care to patients. So it's reducing patient error. It's about providing the environments where people can live independently much longer, get their care at home, so avoiding long stays in hospitals. So ICT is much more than just providing care at a lower cost. We look at big solutions, but there are also very small solutions. A lady having to travel 200 kilometers for a weekly consult can be avoided by a simple webcam. So some of the solutions are not about big system changes. They're about very simple introductions of technologies. And when it comes to big systems, yes, they will, they will cost money. But like any investment, you invest first and you make an assessment of what it's going to deliver in cost and benefits, and obviously you make the investment because you think there is an overall benefit to your investment. So making the investment today to may have savings down the line and to have better care provisions down the line, I think is something that anybody who has to make an investment decision will have to face up to. There are big investments in political will, leadership. There are big investments in organizational changes. So it's not so much the finances. It's much more the change in the heads of all of the actors, the insurers, the care providers, the politicians, the patients, is how to interact among these different groups and what the technology can do to facilitate that. These things are never easy, but I think that the doctors and the care providers quite rightly have one main concern, and that's that the patient's interests are guarded, and that the best possible care is provided to patients, and that the patient information is treated well, and all these kind of concerns. So there are a lot of legitimate concerns involved. And on the other hand, yes, it's a profession that has very strong traditions, and information technology has this quality to it that it does tend to disrupt existing structures, because you can do things differently, and it'll empower patients in a different way than it did before. So the relation between the patient and the doctors will be a different one. But I think there's a lot to gain for doctors and the care providers as well. And so if the incentives are right, and I'm quite positive. I think there's enough in there also for the care providers and the practitioners to embrace this and to support this agenda.